In this video, I will go over the 5 most common questions I get from women about their pelvic floor health. You may be a woman listening to me right now or watching this video, and you may have had this question and you've wondered, what is the difference between a gynecologist, urologist, and a urogynecologist? So you've been wondering, who should I see exactly? Well, a gynecologist takes care of women's reproductive health, breast care, bone health, and hormonal health. A urologist focuses on the urinary and genital tract for both men and women. They take care of problems of the kidneys, the ureter, the bladder in men and women, and then including the prostate in men. However, a urogynecologist, that's where, both worlds kind of come together. A urogynecology specialist, we have the advanced training in gynecology and female urology, and we specialize in a woman's pelvic floor health, including the bladder, urethra, the gynecologic organs, the reproductive organs that can arise, such as prolapse, incontinence, bladder infections, interstitial cystitis, genital urinary syndrome of menopause, pelvic pain, overactive bladder symptoms. And it's a great question that I get all the time. Another one is, a gynecologist, takes care of a woman's reproductive health, everything from pap smears, contraceptive health, pregnancy, and menopause. While a urologist takes care of both men and women, a urogynecologist concentrates only on women, and we have that combined training of gynecology and urology, and we focus on specific issues that affect a woman's pelvic floor. As I mentioned before, we take care of bladder prolapse, fecal incontinence, bowel prolapse, bowel incontinence, pelvic pain, and these things can really affect a woman's daily life and confidence. Think of a urogynecologist as a bridge between gynecology and urology, where we specifically focus on a woman's pelvic floor health. Bladder prolapse and bladder leakage are very common conditions that affect women, especially with aging and as women have children. The second most common question I get asked is, so what can I do to prevent bladder prolapse and bladder leakage? Well, there are things you can do. Repetitive heavy lifting is key. Maintaining an ideal and healthy body weight is another one. Avoiding straining or excessive straining with constipation is another one. And doing pelvic floor exercises or Kegel exercises is helpful. And then the question I'll get is, what if the Kegels aren't working? What can be done? Well, there's pelvic floor physical therapy that can be done, strengthen the muscles, or women can be fitted with a pessary in the office, which is a device to help maintain support and help with symptoms. Now, there's really a difference that women feel when they do the things that they have control over, like avoiding heavy lifting, avoiding excessive straining with bowel movements, because constipation can make the prolapse worse. Doing Kegel exercises and making that a part of a regular routine is key as well. Now, this may all sound simple, but being consistent is very important. Your pelvic floor muscles are like the muscles that really, they get stronger with practice and with time. Third question I get asked is, I've tried Kegel exercises, but they're not helping. What else can I do? You're not alone. I hear from many women who've been diligently doing Kegel exercises and they just are not seeing the results. And if that's you, don't get discouraged. It doesn't mean that you're doing anything wrong. It's something that can get a little more challenging over time. Sometimes the muscles get weak in ways that, they need to get targeted help. And that's where pelvic floor physical therapy comes in. A specialized therapist can help you learn the right techniques and in some cases help to retrain the muscles so they're not too tight and they're actually working properly. And as I mentioned before, pessary devices, these are small supportive devices that can be fitted in the vagina. They help to support the bladder, the uterus when there's prolapse. They can also help with leakage. There's some for bladder leakage. There's even pessary type devices for bowel leakage. These are non-surgical approaches, non-surgical treatment options that work well for women. So another question I get is, am I too old for surgery? No one wakes up in the morning and says, I want to have surgery. If conservative options are not helping enough and surgery seems to be the next best options, do know and be rest assured that surgeries nowadays performed by urogynecology specialists like myself are minimally invasive, they're safe, they can improve a woman's quality of life, comfort, confidence, and control. So no, you are not too old to have pelvic floor or minimally invasive surgery, especially if it's vaginal or laparoscopic or even robotic. These are safe, minimally invasive, effective options for women of all ages. And then the last question is, who's the best type of person or doctor to see for this type of surgery? Now, this is such an important question because you need to choose the right specialist, and that makes the biggest difference. So for pelvic floor prolapse and incontinence, the best doctor to see is a urogynecologist. Why? Because we specialize in female pelvic floor surgery, and that's all we do. And we have the advanced training in gynecology, urology, female urology, as well as the repairs that are required that give the best outcomes, shorter operative time, quicker recovery, and good outcomes. So if you're you're a woman who's been dealing with prolapse and incontinence or any kind of pelvic floor concern, know that you are not alone. There is hope. You do not have to live or put up with it. They're good, safe, and effective solutions. You can get your life back and feel like yourself again. Dr. Tugbiyele here, board certified, fellowship trained urogynecologist, top doctor in Atlanta, Georgia, and I've helped thousands of women with various pelvic floor issues, most commonly pelvic floor prolapse and bladder leakage. You're ready to get help, ready to regain your quality of life, your confidence and control and comfort. Or if you know of a woman who needs that help, I invite you to work with me. You can visit my website, drtugbiyele.com. The link will be in the bio or in the description, or you can call my office at 770-292-4200. You do not have to live with this. Imagine how you'll feel when you no longer have to deal with prolapse, discomfort, embarrassment. You can do all the things you enjoy doing, and your confidence is back, your comfort, and your quality of life is restored. All of this is possible when you work with me, so I do invite you to work with me. Again, my website is drtugbiyele.com, or you can complete the inquiry form on my website at that website, or call 770-292-4200. You'll be able to laugh, exercise, travel, and be intimate with your partner comfortably again. All these things you can enjoy, and this is what I want for you. All of this is possible for you when you work with me, and I'll see you in the next video.